My name is Lorraine Apodaca. I attend Alliant International University in Fresno, California. I will present empirical research on victims of child and adolescent homicide in Fresno, California, recommendations to reduce risk factors. The relevance in narrowing the research scope of young people in Fresno, California can best be supported by literature that suggests that homicide is the leading cause of death for children in the United States, and the violent crime rate in Fresno is the highest in the nation. With that being said, a group of professionals identified homicide death rates of non-adults in Fresno to be of great concern, and a Youth Homicide Review Board, or YHRB, was established to address the issue. The review board incorporated professionals associated with the Fresno Police Department, Coroner's Office, and healthcare systems. Together, the board established procedures in which non-adult homicide should be documented and processed. The data collection was given to our institution for analysis and is the primary purpose of our research. To understand what factors contribute to the high rate of youth dying via violent crime in Fresno, California, a literature review was conducted to establish a general understanding. A few takeaways from literature suggest that child abuse, neglect, absence of positive role models, leadership crisis, witnessing violence, gun access, substance use, and poverty are contributing factors for violent behaviors in youth. Hyde, 1999. Children aged birth to 5 appear disproportionately exposed to traumatic events. Chu and Lieberman, 2010. Older children tend to perish by firearm. Sharp force trauma, asphyxia, and BFT, blunt force trauma, Savgo and Reset, 2008. Overall, literature strongly argues that child and adolescent homicide cannot be considered one-dimensional. These arguments lead us to our work with the current data sets to identify patterns and risk factors. We hypothesize that young male children will have a higher homicide rate than other age groups by blunt force trauma. Methods used for our research include archival data collected from YHRB. Additional data was gathered from the Department of Justice, or DOJ, and both data sets were used for comparisons. Both data collections were analyzed geographically. The YHRB data used incident zip codes to identify homicides in areas with lower or socioeconomic status. DOJ data was limited to incidents in Fresno, California. Primary variables or identified risk factors included cause of death, which was condensed into blunt force trauma, or BFT, gunshot wound, GSW, sharp force trauma, SFT, neglect, or other. Age of the victims were condensed into 4 categories, including ages 0 to 5, 6 through 13, 14 through 17, and unknown. Gender considerations was male or female. Chi-square contingency tables were used to explore expected outcomes with real occurrence to identify local effects on youth homicide at the 0.0 level of statistical significance using Jeffrey's amazing statistical program software. Comparing age to cause of death, both data sets established statistical significance by p equaling 0.001 and showed a consistent trend where youth ages 0 to 5 were killed via blunt force trauma with an occurrence rate of 87% of all homicides. Based on the age of the victim and the cause of death, it can be asserted that these deaths were a result of child abuse. As the age of the victim increased to 6 to 13 range, the data indicated a reduction in homicide. However, upon entering the 14 to 17 bracket, firearm-related deaths accounted for more than 50% of all deaths. Comparing age to gender, the YHRB did not find a significant interaction based on alpha rate of 0.05. However, DOJ data found a significant interaction. The data concluded that more males than females are killed in all age groups. When discussing these results, it is clear young children are at a disadvantage and a higher rate of homicide because they developmentally lack the ability and skills to protect themselves, whereas ages 6 through 13 may be protected by being in school or attending after-school programs. And adolescents ages 4 through 17 enter into a high risk due to growing independence, less supervision, and a primary age for males to be introduced into gangs. To reduce homicide risk factors, the following recommendations are considered. To improve community altruism, community members and agencies should work together to reduce homicide rates. This can be established through the following recommendations, such as increasing community awareness through media, billboard advertisements, and established agencies. Another recommendation is providing educational parental classes to new mothers specifically with low SES. Education should focus on providing skills to soothe young children, parental techniques to gain compliance without force, and coping skills to help parents when feeling frustrated. The broken window theory suggests improving environments can reduce crime. Thus, environmental recommendations include demolishing abandoned buildings and homes, greening the community, adding more streetlights to darken areas, and constructing speed bumps to reduce crime. Lastly, collaboration of community agencies can provide stronger community support. References and link to study. Thank you.